Hello and welcome to SRG's Medicine. Today, in this video of Respiratory Medicine Series, we shall be concluding our talks on the topic dyspnea. So the contents of this video are goals of treatment, treatment algorithm, and ultimately the summary of this whole series on dyspnea. So the goals of treatment would be, firstly, correcting the underlying condition which is driving dyspnea. So here we have to do two things. The first is if the cause is potentially reversible or completely treatable, then we have to go for the appropriate treatment for the condition which is causing dyspnea. Whereas, if the cause is irreversible or not completely treatable, for example, chronic obstructive pulmonary disease, so in such condition, we have to control the severity of disease and limit the further progression of disease and presentation of other complications. And the next thing that we have to do is if the disease is untreatable at all or disease is causing excessive effect on the patient's lifestyle, then we have to provide supportive treatment. For example, supplemental oxygen, bronchodilator therapy, and adrenergics for allergic exposures, etc. So, moving on to our treatment algorithm. Here, we have the first thing that is history, physical examination, and walking oximetry or peak flow assessment. So if these tests or these assessments would give us our diagnosis, then we have to straight away treat the cause if possible. Or, as we said earlier, limit the progress or severity of disease and prevent from further complication. Whereas, if these tests, that is, if a history taking, physical examination, walking oximetry, and peak flow doesn't give us our diagnosis, then we have to move to phase 1 of laboratory studies, which includes chest x-ray, spirometry, ECG, CBC, and basic metabolic panels such as arterial blood gas analysis, electrolyte, urea, etc. So, if all of these tests would give us our diagnosis, then again we go to treatment. Whereas if it doesn't give us our diagnosis, then we have to move on to phase 2 testing, which includes chest CT, lung volumes, diffusion capacity of lungs, tests of neuromuscular function, echocardiography, cardiac stress testing, or if thromboembolic diseases are considered, then angiography. And if all of these tests would give us our diagnosis, then we again move on to treating the cause. However, if there is no diagnosis obtained till now, so till phase 2, then we move on to phase 3, whereby we do cardiopulmonary exercise testing and do specialty or subspecialty referral to a pulmonologist or a cardiologist. So that was our treatment algorithm. Now, I'll be summarizing all of the things that we have said in the video of the respiratory series on dyspnea. So these are just a short review or short summary of those. So the first thing is dyspnea is a subjective experience which varies according to the condition patient is in. Dyspnea can occur via increased mechanical effort of breathing, central or peripheral conditions which produces compensatory tachypnea, or psychogenic conditions. Dyspnea can be measured semi-quantitatively via Modified Medical Research Council dyspnea scale. The causes of dyspnea can be pulmonary, vascular, chest wall and pleural, cardiac, or miscellaneous. So miscellaneous if they don't fit in any of the above four, that is pulmonary, cardiac, chest wall and pleural, or vascular conditions. So the next point that we talked about was assessing the severity of patients and assessing whether the previous condition is worsening along with dyspnea or not, provides us with a proper base for starting our diagnosis as well as treatment. So that provides us a good clue and a lead to our diagnosis and treatment. In history taking, we talked that the timing, quality, effective position, associated features, and the effect of dyspnea on the patient's lifestyle. They are the most important questions which needs to be asked in a patient with dyspnea. So in examination, we mentioned that we have to check vitals, including airway, breathing, circulation, and temperature. An inspection, including general inspection such as PICK, COLD. So that was the mnemonic that we used there, and cardiorespiratory inspection, along with palpation, pulmonary percussion, and auscultation for cardiorespiratory sounds. And ultimately, the important one, that is pulsus paradoxus. So these are the important parts of physical examination for a patient with dyspnea. And ultimately, we have said that the laboratory studies is done in 3 phases, one followed by another only if the preceding one doesn't give us a definitive diagnosis. And the treatment will focus on the underlying cause, followed by symptomatic treatment if required, or if treatment of the underlying cause is impossible. So only on such conditions. So whether that be palliative form or non-palliative form. So symptomatic treatment is given only after the attempt to treat the underlying cause. So this was my summary on dyspnea, on the whole series of dyspnea that we talked about in the previous 4 videos and this 5th video as well. Hope you enjoyed it. Thank you. Stay tuned for upcoming videos. Stay safe, stay well. Thank you.